Hello, my dear NORCET-8 future nursing officers. Welcome you all to the master nursing classes. As I told in my every crash course sessions, bacho, this is very important. The questions will strike from here. Don't neglect this one. And the important thing, I have repeated three times, and I have told you to you people. Wherever the word I have written, this is important. That is directly came in your exam. And wherever I told this question will come with the same option, yes, that question directly came in your exam with the same options, right? So yesterday I got 1,000 of the messages, continuous messages is in my WhatsApp group. Sir, all the questions from the master nursing classes, all the questions from the Nagaraj sir crash course. But so this crash course, what I have conducted this one free of cost in my YouTube channel. Whatever the questions I am trying to show you today, every questions are the direct questions which directly strikes from our master nursing classes in your NORCET-8 prelims exam. So, and it is very important to know the all the questions with the correct options and answers. Why? Because a NORCET-8 prelims exam questions, there is highest chance to repeat in the mains exams. As you've seen in the last three exams, there are 2 to 3 questions with the same options. Those options from the prelims it will comes in the mains exams. Why? Because the mains exam is containing only nursing portion, and that nursing portion are 160 questions. So last time 2 questions from the blood transfusion and one more questions from the psychiatry. Same thing which is came in our prelims, which is repeated in the mains. So this is the reason you have to be confirm again the questions to know the correct answer what you have chosen and what was the correct answer before going to the mains exams. So I will clarify you a very important all the questions which will came in your prelims exams with the same options. So be with a notebook and pen and note down the things what I am showing you here. Okay, and I will show you how many questions are strike from our master nursing classes free crash course, and a 99 percentage paper including the nursing non-nursing which is there in our prelims exam is from the master nursing classes test series. So in due course of the time I will show you with the proof a PDF I will share with you people. Okay, you will come to know that what is the power of the content which we are giving in the master nursing classes, right? So here we are, like these are the feedbacks. Okay, just a sample of the feedback I got from my team. Okay, so yes, directly students telling you, sir, the 1/3 of the paper, directly 1/3 of the paper just from your rapid revision. Bacho, rapid revision classes, I have not conducted 30, 40, 50, 60 classes. Just 12 classes plus 3 special classes. Just in a 15 classes, I have striked a complete 1/3 of the paper. Okay, and just a 30 prelims test paper, I have reached the 99 percentage of the prelims questions. So this is what the experience and the mindset and analysis stands with a great result. Right? So these are the 1,000 of the feedbacks we got from our aspirants. So once again, I am thank you to every master nursing classes aspirants to believing in us and to study our content. So it will be just motivates us again to give you a quality content, right? So these are the samples of the our feedbacks what we got here, and this is the first question, directly image based question. What I thought you people in the crash course, okay, with the CVP line, 3 lumen CVP line with its ports and its functions clearly I have mentioned. Just image based questions came in your prelims, and in the mains definitely the functions of the CVP line ports will be coming. Okay, so don't neglect this one. So who all are not seen this video, again you have to see that one. Okay, So one is confirmed, and this question directly straight from the crash course. Okay. So what is the most common type of the reaction observed during the blood transfusion? Okay. So I told this is the febrile non-hemolytic transfusion reaction. That is the FNHTR is the correct answer for this one. This is the most common reaction which is happens during the blood transfusion, and this is the question what I thought to you people in our crash course. Okay, which of the following is the most common complication of the blood transfusion? Similar same question body. Okay, so here in the option febrile non-hemolytic transfusion reaction, in short form I have shown to you people FNHTR, and this is most common I have shown to you people. And yes, a treatment also I told, that is the injection PCM 1 gram we have to give if the FNHTR comes in the exams. Okay, so this is from the crash course video, right? So then comes to the next question here. Yes. So yes, what is the ECG changes in the hypothermia is the questions. Okay, I hope the same options will be you people were getting there. ECG changes, the J wave also will be present. The Osborne wave or the J wave, both are same. And tolerability wave. This option also will be there in your options. And the correct answer for this one is the Osborne wave and J wave is the correct answer. So if you have chosen this correct answer, because tolerability wave we will not see in a hypothermia cases. Okay, just Osborne wave and J wave is the correct answer. And this is what I have taught people in my crash course session of the ECG. Okay, but a prominent J wave is associated with which of the following condition? There I have told you option D, that is the hypothermia goes correct answer. And in the explanation clearly, how clearly I have written, you people can be able to see. Yes, a J point is the normal, but a J wave, the J wave is the abnormal, and the J wave we call as the Osborne wave, so which will be seen in the hypothermia. इतना प्यार से समझाया था मैंने, so that was very helpful in the prelims exam. Okay, so the correct answer for the ECG changes in the hypothermia which was asked in your exam is our, yes, the Osborne wave or the J wave, right? So this is also a special classes ECG class what I have conducted just before the exams, so that was very much helpful to you people. Okay, so and yes, one more important announcement. We have announced the NORCET mains mission test series, which will be containing 20 predetermined, pre-planned, completely planned test series of the 20 questions papers, where we will inserting those high yield questions that will strike in your mains exams again with the same options. Okay, so if anyone wants to be a part of the NORCET mains mission test series, I have given the link in the description box. You people can visit there and download the Master Nursing Classes app. Okay, so visit our test series portion. There you will get the NORCET mains mission test series. This, okay, so which is a very affordable price. Okay, so yes, as usual. So this was the simple announcement here. Then the next one are same questions. Okay, what I have thought to you people, same to same question, same to same question, right? So in the crash course session, what is the generally defined as a massive blood transfusion? Okay, I hope option also you people have got the same here. The transfusion from the more than 4 units packed red blood cells in the 24 hours. So this was the more than 4 units of the packed, not packed red blood cells. Okay, so here the transfusion of the more than 10 units, not 4 units here. Okay, more than 10 units of the whole blood in the 24 hours. This was the correct answer I have told to you people just before going to the exams. I have conducted it in the crash course session. These question directly struck in your exam. Okay, so hope it is very much helpful to you people. Okay, so this is the screenshot again from my crash course. Okay, the correct answer of the massive blood transfusion is the, yes, the transfusion of the more than 10 units of the whole blood in the 24 hours. So this is the correct answer. And in the option D, they have given a more than 50% of the circulatory volume we are replacing in the 24 hours. No, bacho. Actually, the another definition of the massive blood transfusion is the, yes, that one also I have told, more than 80% of the circulatory volume in 1 hour we are replacing, means again we call this one as the massive blood transfusion. So this was I have explained clearly, but in the options they have given the 50% of the circulatory volume. That was the wrong option. And here you people have, I think almost you people have chosen the correct answer who are watched my test, this one crash courses during the exam time. Okay, so the transfusion of the more than 10 units of the whole blood in the 24 hours. So this was the correct answer, and this is directly struck in your exams. Okay, so that was, I think, clear to you people. Then comes to the next question. A 68-year-old with a history of the COPD presents with an increasing shortness of the breath, drowsiness and confusion. Yeah, it is question which is there in your prelims exam. Okay, COPD case was there. Yes, sir. And increasing shortness of the breath is there. Drowsiness, confusion is there. And ABG value shows the PaCO2 of the 68 mm of Hg. So which type of the respiratory failure and what is the initial management? So they have not asked the initial management. So just they have asked the which type of the respiratory failure. Yes. In the ventilator session, the special class I have conducted during the prelims exam, I think just 4 to 5 days before the your prelims exam. There I have clearly explained to you people. Okay, the type 1 respiratory failure is also called as the hypoxic respiratory failure, wherever SpO2 is less than 80 percentage. Okay, and a type 2 respiratory failure, that is the hypercapnic respiratory failure. Okay, this is what we call as the type 2 respiratory failure. It is classically seen, I told you, in the COPD case. Okay, only one example given. That example only came in your exams, right? So here, what I told to you people, if the PaCO2 is more than 50 mm of Hg and PaO2 is nearly or decreasing or nearly normal. Okay, that one I have told to you people. Here in the options also same to same the scenario have created here. What I thought to you people, right? So what was the scenario? Yes, the COPD patient, it was there. Yes, sir, it was there. And PaCO2 is the more than more than that is the 68. It means the PaCO2 here is more than 50. So we call this one as the hypercapnic respiratory failure or the type 2 respiratory failure. This was the your answer. So this was directly struck in your exam. And few of you have chosen the chronic respiratory failure. But so here we are having the 4 type of the respiratory failure. I have clearly explained to you people. First one is the hypoxic, second one is the hypercapnic, third one is the post-operative associated respiratory failure, and fourth one is the shock associated or the hypoperfusion associated respiratory failures because of the low blood circulation to the respiratory muscles in a shock condition. Because of that, the respiratory failure is happening, means there is a type 4 respiratory failure. I told you people. Okay, so the correct answer which was there in your exam is the type 2 respiratory failure. That is the hypercapnic respiratory failure, which will be seen classically in the COPD. That is what clearly I have explained to you people. Okay, hypercapnic respiratory failure or the type 2 respiratory failure. Okay, so here the PaCO2 is more than 50 mm of Hg and which will be classically seen in the COPD. The same situation created in your exam. Okay, so hope it's helpful for you people, right? So here is the image based questions where the examiner asked the people, yes, he only given the answer in the image and he asked the people in which tracheal ring the hole was created or the tracheostomy opening was created. The answer is between the, yes, you people can see here clearly, this was the 4th tracheal ring and this was the 3rd tracheal ring. Okay, in between we have created the hole, so that is the between the 3rd and 4th tracheal ring was the आंसर हियर. सर ये क्वेश्चन भी आपने बताया था क्या? यस बच्चा, ये क्वेश्चन भी मैंने बताया था आपको. हियर इज द प्रूफ फॉर दैट वन. दिस इज द वीडियो फ्रॉम द क्रैश कोर्स सेशन. ओके, but I have drawn this one with my own hand and I have thought to you people. Okay, and with it's important why we have to create that one also I have thought to you people. Okay, so here I thought to you people that in a laryngeal cancer we have to go for the high tracheostomy and for the permanent tracheostomy between the T2 and means tracheal ring number 2 and 3 we have to go for the permanent tracheostomy. And in the children's and emergency I have thought to people between the 3rd and 4th tracheal ring. Okay, so here the PaCO2 is more than 50 mm of Hg and PaO2 is less than 50 mm of Hg. And with its important why we have to create that one, that one also I have thought to you people. Okay, so here I thought to you people that in a laryngeal cancer we have to go for the high tracheostomy and for the permanent tracheostomy between the T2 and means tracheal ring number 2 and 3 we have to go for the permanent tracheostomy. And in the children's and emergency I have thought to people between the tracheal ring number 3 and tracheal ring number 4. So we have to go for the opening. So this was the what I thought to you people, and the same like image. This is the same like image which is came in your exam and which was asked between the which tracheal ring we have to create the they have created the tracheostomy opening, and in the option between the first, second, third, fourth, and second, third, these were the answer were there. So here we have chosen the answer as the third to fourth tracheal ring. So that was your correct answer. बच्चों समझ में आए कितना इंपॉर्टेंस है, कंटेंट में दम है तो सिलेक्शन श्योर है, वो मास्टर नर्सिंग क्लासेस का स्पेशल पावर है. ठीक है. सो हियर इज द what I thought you people. So that was came in your exam. So then, sir, every day we have seen the morning doses and night notes in our WhatsApp group. Means every day morning we will send a morning dose of the very important triads, mnemonics, that is much necessary for the aspirants to study. Sir, one question came for sir, lethal triad of the death, or the just the question was asking of the triad of the death. Okay, so the triad of the death was the question. So what is the component of the triad of the death? This was the question which was asked in your exam. The correct answer for this one is the yes, hypothermia, acidosis, and coagulopathy. This was the correct answer. So this is the question which is directly came from our morning notes, what we have shared with you people in our WhatsApp group on the daily basis. Okay, so where the Beam sir daily used to share the morning notes and morning dose and night note. Right, in the morning notes we have shared that nursing important points, and in the night note we have shared that the non-nursing very important points. Okay, every day in our WhatsApp group. So this was the where you are following a team which is direct working towards the selection. Means yes, the definitely questions strikes from everywhere. Okay, so this was the question directly struck from our morning notes what we have shared with you people. So that's the lethal triad or the triad of the death. Okay, where the hypothermia and coagulopathy, acidosis. Okay, that's the lethal triad of the death. So direct questions came in your exam. Hope it was helpful to everyone, right? So yes, every day in the morning we used to share a morning dose, and every day at the night we used to share the night note. Sir, ये मेंस के लिए भी शेयर करेगा? Yes, we used to share this one for the mains exam also. If you want to become a part of our WhatsApp group, I have given the link in the description box. You join there. Okay, whatever the mnemonics we are sharing, just a second of the 3 to 4 seconds you take and revise those important trials what we are sharing and important notes what we are sharing. So that will definitely helpful to you people in the upcoming exams. If you want to become a part of this one, yes, I have given the link in the description box. You can join there. Okay, so it's free of cost, no need to pay anything for this one, right? So here is the question. What is the recommended gap between the insulin injection at different site? Okay, so sorry, at the same site, this was the question. You are giving the insulin injection at the same site, especially at the abdominal area. So between one dose and second dose, what is the gap? This was the question asked. Okay, so clearly मैंने बच्चों RRB and NORCET-8 and NORCET-8 combine के लिए मैंने very important सेशंस कंडक्ट किया था. उसमें क्लियरली बताया दिस इज द umbilicus, around the umbilicus, 2 fingers around the umbilicus. Okay, so 1 inch gap or the 2.5 centimeter gap we have to maintain. I have told clearly. So that question directly strike in your exam. Okay, so that is the 1 inch gap, or we used to say this one as in the 2.5 centimeter gap. It was the answer there. Okay, so in the exam they have asked the option with the 2.5 centimeter gap. So this was your perfect answer. Okay, no, this one if the exam it will strikes again in the mains, means give the best shot. Okay, so this was the correct answer. Then comes to the yes, this was the proof where we have taught you in the RRB and NORCET-8 exams. Yes, the RRB exams, whatever the sessions I have conducted, those are definitely helpful for the RRB also. There is no separate syllabus in the nursing. Okay, whatever the questions which are coming from the important questions, that portion only will strike in your RRB exam also. If who all are preparing for the RRB exams, do watch the entire session of the rapid revision. Again, people will get the 30 to 40 direct questions in your RRB exams. Okay, so yes, that was the, I think, clear to everything is clear to you people. Okay, so then comes to the next question. Who is known as the father of the penicillin? Okay, so father of the penicillin is the Alexander Fleming. Sir, why there are thousand of the antibiotics are there? Among the thousand antibiotics, why the examiner asking the penicillin only? Because this was the first antibiotic discovered and which is discovered by the Sir Alexander Fleming. Sir, ये भी question आपने बताया था क्या? Yes, बच्चा मैंने बताया था. Here is the proof. Okay, so here is the proof. You people can see this one. Okay, the drug penicillin was discovered by the drug penicillin was discovered by. Okay, so here I have thought you people, Sir Alexander Fleming is the person who discovered the drug penicillin. So this was the question which is directly came in your exam. Okay, yes, along with that I have explained another options also here regarding William Harvey circulatory system discovered, and Eric Erikson 8 stages of the psychosocial development, and Sigmund Freud's psychoanalytic theory and psychosexual theory. So we have discussed all this one. Along with this one, the directly question what I have discussed in the RRB and NORCET-8 integrated important sessions. From there also the direct questions came in your exam. Hope it is helpful for you people in the exams. Okay. Yes. So the next question is the this was the question regarding the B fast. Regarding the B fast. Okay. So in the stroke management, which of the following is the correct full form of the B fast in the stroke management? Okay, so every coaching centers and everyone they have taught you people regarding the fast. Okay, because no book have given the updated content related to B fast. Okay, this was recently came B fast. Okay, so here also we have thought you people related to the fast only. Okay, so fast warning sign of the ischemic stroke. Okay, so ischemic stroke of fast is the warning sign where the F stands for the facial weakness, A stands for the arm weakness, S stands for the speech problem, and T stands for the time to shift to the hospital or time to call the emergency. Okay, so this was what I thought to you people. Okay, so in the neurology session, right? So here they have asked related to the B fast. Okay, so what this B fast, sir? B is the balance issue. Means when the patient will undergo into the stroke, the patient balance will get disturbed. Then E is the eyesight changes. Okay, note it down, bacho. E is the eyesight changes. Then F is the facial drooping, which is directly came here. Okay, facial weakness or the facial drooping. Then comes to the arm weakness. Okay, so arm weakness. Yes, F stands here is the arm weakness, and then comes to the speech problem or the speech difficulty. Then S stands here as the speech problem or the speech difficulty. Then a time to call emergency or time to shift the hospital. So B fast का मतलब है. So this is the warning sign or the initial sign of the stroke where these symptoms are coming. We have to be very fast. Okay, to take interventions to prevent the further damages by the stroke. Okay, so this was the question directly came again from what we have thought to you people. Okay, so here is the next question. Yes, the question is like this: a pregnant woman of the 12 week of the pregnancy presents to the healthcare facility. Means in the options in the exam, this is the question which is came from our test series. Okay, and the same questions just at the health center they have given your primary health center. Okay, so a pregnant of the 12th week of the pregnancy presents to the health center. They have written primary health center, PHC, for the routine checkup, and the healthcare provider notes that her her hemoglobin is 12 gram per deciliter. Means it is absolutely normal in the pregnancy. Okay, and suggest of starting the iron and folic acid supplementation as a part of the Anemia Mukta Bharat program. What is the correct dose? Okay, so in the options they have given the different options where they have mentioned weekly, monthly, daily. Okay, but the correct answer is a 60 mg of the iron and 500 microgram of the folic acid. Again, this question directly striked from our integrated RRB and NORCET-8 session. Okay, so here I have mentioned that clearly to you people, right? So the correct dose of the iron and folic acid supplementation for the pregnant woman under Anemia Mukt Bharat program, and clearly I have mentioned this one. Yes, 60 mg of the elemental iron and the 500 microgram of the folic acid daily. This one green highlighted one is the correct answer. And other thing also for adolescent girls and school girls, what we have to give. So, and what is the WIPS program? I have clearly explained in the very important rapid fire wildfire sessions, okay, and important OBG session also. I have repeatedly explained this one, okay. So that was the question which was directly asked in your prelims exam, okay. So hope this one is very much clear to you people. And here's the next question: the National Deworming Day. Okay, we have to celebrate this one as the biannual program, okay. Biannual program. Okay, so biannual program. Biannual program means we have to celebrate this one, or we have to use to implement this one 2 times in a 1 year. Okay, so what is the 2 times we have to initiate this one? Okay, in a 1 year, that was the February 10 and the August 10 was the your correct answer. Okay, Feb 10 and अगस्त 10. So this was the correct answer. Sir, ये भी आपने बताया था कैसे? Yes, बच्चा ये भी बताया था. Here is the proof. Look at this one. Yes, the deworming where we are using the tablet albendazole, and with the age group also I told less than 2 years 400 mg, more than 2 years 400 mg, less than 2 years 200 mg, and this is the biannual program. Here I have written at that time February 10 and August 10. Okay, so that was the very important. Okay, so what I thought to you people regarding the deworming. Okay, this is again you people can see from the integrated important RRB and NORCET-8 session, right? So hope this was also helpful to you people, right? So here is the one more important questions. बच्चों separately मैंने 2 sessions conduct किया था OBG manuals के लिए, क्योंकि these manuals are very important and which seems somewhat difficult to the aspirants to study this one. In order to make it very easy to understand to the every aspirants, I have conducted 2 sessions on the OBG manuals recently during the exam. Okay, so still those classes in my YouTube channel you can go and watch. Okay, so where I have clearly explained each and everything to you people, how the question will arise. Not only image based questions, the question will come from the purpose and use of the manuals. Yes, the question came from the purpose and use of the manuals. I will show the proof of this one in the next slides. Okay, don't have to worry. First we will see the what was the correct answers we have chosen here. Okay, what is the actual correct answer? Okay, so Bandl-Andrews technique, I told this one is also known as the controlled contraction, which is we are using to deliver the placenta. So the D goes to the second one. Okay, so then comes to the Pinard maneuver. Pinard maneuver is used to deliver the extending leg in the bridge. Okay, so then Ridgen maneuver. Ridgen maneuver, bachcho, this one I have told this is primarily used to prevent the perineal trauma during the normal vaginal delivery. Okay, where we are delivering the controlled head delivery we have to do here. Okay, so that was the controlled delivery of the head. So I have thought to you people very clearly. And Lancet maneuver, we are using this one for the delivery of the shoulder in the bridge. Okay, so this was the what actually match the followings in a single question. All the use of the manuals the examiner asked the question. Okay, so here what I thought to you people related to the controlled contractions in the crash course session, controlled contraction or the modified Bandl-Andrews technique. Okay, during this class I have told to you people, bachcho, if the word control contraction was not there in your option, means definitely examiner will give the word that is the Bandl-Andrews technique or the modified Bandl-Andrews technique. I told clearly, but you don't fear, both are the same. I told to clearly, very clearly. And the word what I told to you people, that is came in your exam. Okay, so that is very much helpful, I think so, for you people, right? So here is the Bandl-Andrews technique used for the controlled cord traction and delivery of the placenta. Okay, so I have thought people clearly. And Pinard maneuver, image based question, and Pinard maneuver in the OBG important maneuvers. Okay, so yes, this is to deliver the extended leg in the bridge with clearly I have explained to you people. And the question also came from the surgical safety checklist, and again the class of the crash course, okay, where I have taught you people related to the surgical safety checklist, and with the mnemonic I have taught you people, okay, where the sign in, time out, okay, and sign out. Okay, here I have written SITO so that is the so with mnemonic I told, and the question was asked like, so a sequence, okay, what we have to follow here, and that one I have written and told to you people in the sign in, that is before induction of the anesthesia, time out before the skin incision, and sign out before sending the patient out of the OT, where I have discussed you people what are the interventions specially we have to take, where we have to assess for the gossipyboma, and if the gossipyboma present, what we have to do the next intervention, everything I have told during the surgical safety checklist. Okay, so hope this one also very much helpful to your exams. Okay, so here is the next question. Yes, a 3-week-old infant is brought to the emergency. The infant is brought to the emergency department with history of the forceful and non-bilious vomiting, non-bilious projectile vomiting. On examination, appears dehydrated and lethargic and palpable olive-shaped mass. Okay, palpable olive-shaped mass in the left epigastric region. Okay, so what is the electrolyte imbalance which happens here? This question I have thought people very simple. Okay, if prolonged NG sectioning, if vomiting is there, so the metabolic alkalosis happens clearly. I have told you people, and here they have given that is the patient is having the non-bilious projectile vomiting with the integration with the case of the pyloric stenosis. Okay, where the olive shaped mass, okay, we will be seeing here. Okay, so that was the very clear, and this is the case of the respiratory alkalosis, and found out the answer here. Which one is the respiratory alkalosis? Here the 7.38 is the normal pH, eliminate this one, and here the 7.25 is the acidic pH, eliminate this one, and 7.30 is the acidic pH, eliminate this one, and here is the pH 7.48, bicarbonate, the pH CO2 47, and bicarbonate is 34. Means our pH increased, bicarbonate increased. Okay, so this was the respiratory metabolic alkalosis case. Okay, so which we'll see in the acid base imbalance. So this was the question which was asked in your exam. I think in the pH they have given 7.68 something. Okay, so that is also correct answer. Okay, so I hope this question is clear. And what I thought in the rapid revision is the, yes, in the what happens pH in the vomiting. Okay, and there is the prolonged NG sectioning. Okay, that was the directly striker question. 3 questions I have told to you people in the acid base imbalance, where one is related to the metabolic alkalosis in the NG tube sectioning, and one more is related to the ABG values interpretation, how clearly we have to interpret the value, and one is related to the compensated, uncompensated, how to identify that one with a short trick I have taught you people in the last video of the crash course, that is just one day before of your exams. Okay, from there the questions tracked here. Okay, so here is the next question. Which of the following is a drug not commonly used in the rapid sequence intubation? Rapid sequence intubation, which of the following drug is not commonly used? The midazolam is the a drug, old one, we are using as an best drug previously to become used in the rapid sequence intubation. Yes, we will use the midazolam. And thiopental sodium is the anesthetic agent we will use during the rapid sequence intubation, and propofol also we will use during the rapid sequence intubation. Diazepam is not recommended during the rapid sequence intubation. I have taught you people the drug used in the intubation, that is the rapid sequence intubation, where I clearly told you people. Okay, so the question what I asked related to the commonly used muscle relaxant during the intubation. In that one, look at this one. All the important drug and new drug, updated drug, I have integrated, and whatever the options you got in the exam, the same options what I have taught you people. Okay, with clear explanation of the anesthetic drug, muscle relaxant drug. Okay, in this explanation, who all are seen and who all are taken note of this one, who all are revised. So the difficult question what you have got in your exam is very clear to you people. Okay, so this was the reaching the peak point of the selection by the master nursing classes. Okay, so where experience meets the dedication, where the experience meets the teaching hungry. So the selection will be a nothing in front of us. Okay. Yes. This was the question. What I have thought to people, and muscle relaxant. What we are using is the succinyl choline. I have told the most commonly we used to use this one. Okay, and one more, that was the rocuronium. This was the new came, and the anesthetic agent. What I told here, the sodium thiopental, most commonly used one. Propofol, also most commonly used one, and midazolam, old one we were using. This is also used. Okay, so if you got these three options, okay, one more is the diazepam. Okay, if you know that one, the diazepam, so you can eliminate this one very easily. So this is directly extracted from the rapid revision class. Hope this was very much clear to you people, right? So the next question is, who is popularly known as the missile man of India? Yes, my ideal, my strength, my proudness, that is Dr. APJ Abdul Kalam sir is called as the missile man of India. Okay, so the Dr. APJ Abdul Kalam sir is also called as the missile man of India. This was the question directly extracted from the our test says. Okay, so the next question is very simple again, same to same question. What I have taught you people in the very last class of the rapid revision, the first line treatment of the hyperkalemia with 6.8 milliequivalent per liter of the potassium. The same question which is came in your exam. Look at this one. Okay, so but the somewhat scenario was different. Okay, yes, let it be. What is the difference? We'll see. Okay, yes, here also they have given the potassium level of the 6.8 milliequivalent per liter. Okay, and they have given the evidence of the ECG also, that the tall peak T wave and wide QRS complex. So what is the first line treatment they have asked? Okay, so yes, this was what they have asked there. Okay, so let me read the complete question. 58-year-old male with a history of the chronic kidney disease presents to the emergency department with a muscle weakness and a palpitation. Right, so ECG shows the tall peak T wave and wide QRS complex, and its serum potassium is the serum potassium level is 6.8 milliequivalent per liter. Okay, what is the first line treatment? Right, the first line treatment I had told to you people, that is the don't give the IV calcium bolus. This is also in the option. Who all are make a mistakes, okay, who all are didn't read the option carefully, so that is very much dangerous to you people. Okay, so clearly I have told to you people, calcium gluconate should be given IV infusion with perfect dose also. I have told to you people in the explanation. Okay, so in the explanation of the last class, you people can refer for the explanation what are given to you people. Okay, calcium given only by the infusion route. Okay, what I thought again, the 10% of the calcium gluconate with 100 ml of the normal saline for the duration of the 30 minutes. We have to infuse this one. So this is what I have clearly explained to you people. Okay, so again the direct question strike, administration of the 1 gram of the calcium gluconate IV. Okay, so here the 1 gram stands as the 10% for 100 ml NS again. So with proper dosing also I have clearly explained to you people. And the first line treatment of the hyperkalemia, yes, you people I think got here. And I have compared what to choose the answer, when to choose the insulin and dextrose as the answer, when to choose the furosemide and the K binder as the answer to reduce the hypokalemia, everything. So to reduce the hyperkalemia, everything clearly with the flow chart I have written and explained in the last video of the rapid revision. Yes, the question directly struck from there. Okay, so this was makes the actually teacher happy when he dedicates, when he works on that one. So the difficult questions which are making my aspirants to easy means my purpose is solved here. Okay, so yes, here was the next question. Who was the first Indian astronaut to travel into the space? Okay, so many of you have chosen the Sunita Williams as the answer. Okay, that is not correct one. Okay, that is not correct one. And this was the direct question which is came from our Sunil sir class. Okay, which was the first satellite of the India? They have asked in the explanation. Sir, tell. Okay, who was the first person of the India to go into space? That is the Rakesh Sharma. And here's the Rakesh Sharma goes to the correct answer. Okay, so I think it is clear to you people, right? So here's the next question. The question is like this: what is the most important nursing intervention immediately after the craniotomy? Okay, so like which position we have to give after the craniotomy if there is no any special suggestion from the a neurosurgeon. Okay, so if the surgeon is prescribed the give the patient flat position, so we have given the flat positions. Okay, but if there is no any interventions related to the position after the craniotomy, which position we have to maintain properly, the examiner asked. Okay, so that is the correct answer. The elevate the bed, head of the bed 30 degree in order to reduce the okay, in order to reduce the intracranial pressure. Okay, this was the correct answer. This is from the management of the head injury class. Okay, so where I have given the yes, how to decrease the intracranial pressure. Okay, and properly I have written that head of the bed elevate 30 degree. Okay, this was directly it is got in your very important, what we can say, with same options in your exam. Okay, so this was from the neuro class. All right, so again the next question, uh, which of the following is the most common cause of death in the patient with the Guillain-Barré syndrome? Okay, so the question, like, not cause of the death, they have asked the dangerous risk factor of the Guillain-Barré syndrome. Okay, so in the Guillain-Barré syndrome, a ascending paralysis happens. Means a paralysis starts from the down and it will comes up. Okay, and if it involves the muscle of the diaphragm, that's the muscle of the respiration, where is highest chance of the respiratory failure is there, and the most common cause of the death in the JB syndrome, and the highest dangerous risk factor in the JB syndrome is the respiratory failure. This was there in your option, and hope you people got the correct answer. Everyone have given your best answer and correct answer. Okay, so hope it is clear to you people. And here is the next very important question, which is from the Parkland formula. Okay, there was total two questions from the Parkland formula. One, to calculate the fluid level in the first 8 hours of the Parkland formula. Okay, where the scenario they have given the 40% of the body area was burned and the 70% of the 70 kg of the body weight person. Okay, so I will come to that portion also. Just they have asked that question like this: what is the Parkland formula we have to use for the burn for the fluid resuscitation in the burns patient? Okay, so this is very important again for the mains purpose. The answer is 4 ml of the body weight into kg and total body surface area. This was the correct answer. Okay, so hope it is clear to everyone. And yes, same to same image from the test series of the Bandl ring. Okay, same image from the test series of our like related to the Bandl ring. Okay, very important. Here the upper uterine segment and lower uterine segment is separated, and there is formation of the ring in between the abdomen because of the contracted pelvis or because of the obstructed labor. So that is what we call as the Bandl's ring. Who all are chosen the answer this one as in the Bandl's ring. So your answer is 100% correct here. Okay, so this is the same to same image which was given in your exam also, right? So the Bandl's ring, this is related to the Bandl's ring. We will see in the obstructed labor because of the over contraction of the upper uterine segment and inefficient coordination of the lower uterine segment, where there is a formation of the ring between the upper uterine segment and the lower uterine segment. Okay, that is what you call as the Bandl's ring. In the options, yes, there is the contracted pelvis and the contracted ring. So these are the kind of the options was there, and in the option D there was the option that is called as the Bandl's ring. So the Bandl's ring goes to the correct answer for this image here. Okay, so this is the directly striker from the test series. Okay, so hope it is clear to everyone. Then comes to the next question. Yes, a 70 kg person sustained of the 40% of the total body surface area burn. Okay, according to the Parkland formula, how much fluid is required for the first 8 hours of the resuscitation? The direct questions, very important question. Okay, so let us solve this question with applying the Parkland formula. Okay, so here the 70%, 70 kg person means what is Parkland formula says? That's the 4 ml of ringer lactate, 4 ml of the RL, 4 ml of the ringer lactate into total body surface area into total body weight. Okay, total body surface area of the burn into total body weight. Okay, so here's the core is the here, and total body surface area was the 70, and sorry, total body surface area burn was the 40. Okay, 40% was the burn here, right? So then comes to the 70. So if all you are making the multiplication means it will comes around the 11,000 plus when you make it divided by 2, because half of the fluid you will give in the first 8 hours. Okay, so examiner also asked the question, that's the for the first 8 hours how much fluid you have to give. Okay, first 8 hours how much fluid you have to give. So this was the question, and you divide this one means that will come as the 11,200. Okay, so when you divide this one, first half of the fluid from the total fluid we have to resuscitate in the 8 hours, and remaining half of the fluid will go into the next 16 hours. Okay, so very importantly, when we divide this one divide by 2, okay, our answer will come as the 5,600 is the correct answer which will come, and who are chosen the answer as a 5,600, so your answer is 100% correct here. Okay, hope the concept is clear on the Parkland formula and application of the Parkland formula and to determine the right answer. So this was, I think, clear to you people, right? So here is the one more important question came in the matching between the type of the rash and where they have given the specific disorders. Okay, so beams are shared of all the dermatological images, because since last three NORCET exam, there is definitely one questions from the dermatology where they have given the images and we have to choose for the answers for that images. So which is this particular images? Okay, so sometimes the honey rash they have asked, sometimes the pleomorphic rash they have asked. Okay, sometimes last pediatric image also asked. So those all images we have shared in our WhatsApp group just before the exams. I have to specifying this particular disease and this is the image. Okay, so yes, that's the very important notes what we are sharing in our groups for helping the aspirants. Okay, so here we have to choose the correct answers and we have to compare between the type of the rashes. Okay, and we used to give the correct answers. That was the question here to like cross match the samples here, cross match the rashes here. Okay, so maculopapular or the face, the rashes which are starting from the face and spreading downward. Okay, this was not there in the statements. They have given that is the cephalocaudal spread of the rashes. Okay, cephalocaudal spread of the rashes is seen in the measles. Okay, very important. And I have told in the chickenpox measles rashes starts from the from the abdominal area. Okay, and it will spreads everywhere. Okay, so I told how to remember when you eat the chicken, it will go into the stomach. Stomach is in the abdomen. Okay, in the chickenpox also the rashes will start from the abdominal area. So I have told during the previous class how to remember that one also I have told. Okay, so the chicken poxes we can see there is the pleomorphic rashes will be seen in the chicken poxes. Cephalocaudal spread of the rashes seen in the measles. Okay, and in the heat rash there is the small vesicle erythema and itching rashes was there, and flaky rashes will be seen in the scabies. Okay, so these are the very important matching we used to do in the exams. Okay, we have, if you have done this one, okay, at least if you have done for the chicken pox and measles means you will getting the correct answer, because in the options they have given like that one. Okay, so I think it was very much clear to you people. Okay, so yes, the next matching question which was came from the OBs is the oxytocin is used for what purpose? Misoprostol, magnesium sulfate, methyl artemether. Here many students made a mistake that the oxytocin they have chosen for the uterine contraction. But oxytocin we will use for the uterine contraction also, induction of the labor also. बट इन द गिवन सिचुएशन ऑफ द सिनेरियो एक ऐसा परिस्थिति क्रिएट किया था, हमें ऑक्सीटोसिन को बस इंडक्शन ऑफ द लेबर के लिए चूज करना था. Why? Because methotrexate we can't use for the induction of the labor. Okay, misoprostol clearly which was telling of the cervical ripening. Yes. Then magnesium sulfate which was clearly for the eclampsia. Yes, we have chosen this one. And if you have chosen the oxytocin for uterine contraction means you would unable to give the methyl artemether for induction of the labor. So that was the situation and scenario created, and repeatedly I have told in the tricks and tips. But so whatever the answer you know, that is not going to matter. Whatever the answer the examiner actually want to ask to you people, that one you have to respond. Okay, so if you are chosen the oxytocin for the induction of the labor, and if you have chosen the methyl artemether for the PPH, So that is the correct answer. This was only the final answer. Okay, very very important. Okay, which strike with your exam. Okay, hope the concept is clear one. And there is a WHO graph of the growth was there, where they have given with the X mark between the second standard and the third standard deviation. Okay, this was the graph was there, and here you got the option. Okay, so stunting, short stature, wasting. Okay, these were the options you got there. Okay, the correct answer was here is the stunting. That is the stunting. Okay, so means there is a low growth in the height. Okay, this side they have given the height, and here they have given the age. So the same, I think same to same scenario was there to you people there. Okay, why it is stunting? If the x is like below the third standard deviation, we call this one as in the severe stunting. Okay, it is x is there in the given image. X is between the second standard deviation and third standard deviation. So our answer goes here as the stunting. Okay, so while are chosen the option as the stunting for this growth chart interpretation, your answer is a 1000% clear answer and the correct answer. Okay, so then comes to the next very important image. Okay, so this is the image of the, yes, a gastrotomy image. Gastrotomy tube. Okay, this was the image of the gastrotomy tube. That is the percutaneous endoscopic gastrotomy tube. Okay, so this was the answer there. In options you got there is the suprapubic catheter and all. So this is not the suprapubic catheter. This is used for the what we can say the peg tube or the gastrotomy tube. This was the correct answer. Who all are chosen the option related to the stomach and gastrotomy. So that is your correct answer. Okay, so I didn't get the actual options what was there in the exam. Okay, this was what I got the image. Actual this was the image asked in the exam, and this is used in the opening of the stomach and insertion of the stomach, and we have to inflate this balloon to prevent the dislodgement of the this particular tube what we are inserting here. Okay, so this is very very important, and repeatedly 1,000 times asked question from our test series. Okay, related to the teratogenic effect of the drug of the thalidomide. Okay, so I myself introduced this question in the test series 2 times. Okay, so that is the thalidomide side effects. Thalidomide side effect. Okay, I think it is in the day 2 of the test series, where on the third or fourth question. Okay, so where in front of the question I have written, it's very important, and you have to read all the options. Sorry, you have to read all the rationale, because in the rationale I have given the list of all the teratogenic important drugs. Okay, so here I have mentioned clearly. Okay, here the limb defect is there if the mother who is taking the thalidomide during the pregnancy, means she will get the child like this. Okay, so this is the called as the phacomelia. What we call this one is in the, we call this condition as in the phacomelia. We will see in this one in the case of the our thalidomide teratogenic effect. Okay, so here is the ambu bag. But the ambu bag and its parts, and it was called as with reservoir. Everything in the crash course session I have drawn this one with a hand diagram. Okay, and I thought you people, if you want you can refer there. Okay, I'm unable to get the screenshot for everything because it takes a very lot time. Okay, in the just in the crash course session only, while telling the ambu bag capacity, okay, and reservoir bag capacity, everything I have like clearly mentioned in the image, and I have thought to people related to the ambu bag. Okay, so the exam it came in your exam. Okay, so their answer goes to the this one face mask, and this is the expiratory valve, and this was the reservoir bag. Okay, and these only three you have to choose in the options and mark as a correct answer. Okay, so I hope this you people have chosen the correct answer for this one. Okay, and this was the very very important maneuver they have asked. Okay, that's the modified Prague's maneuver we call. But so many people you have confused with a burn marshal technique. Okay, so that is a different situation. That was also how taught to people in the exams. Okay, this is not a burn marshal. Okay, this is the modified Prague's maneuver, where the face is facing upward, and Yes, we are putting this one towards the abdomen, but here the face is facing upward. Okay, so this is the modified Pregue's maneuver. Very very important question. Okay, it may strike again in your upcoming mains exam. Right, here is the next question. A patient prescribed of the corticosteroid, which of the following parameters should closely monitor during the corticosteroid therapy? This was the clear question that was asked from the test series. Okay, so don't know how many times we have asked this one by changing the question body and by changing the options. Okay, but the correct answer always remains as the same. When we are giving the patients to the steroid, means we are giving the glucocorticoid, that is the glucocorticosteroid, means the chance of the blood glucose level increases there. And when I told repeatedly many times, if we are giving the steroid, means it increases the immunity. So we have to monitor for the blood glucose level and a sign of the infection. If who all are chosen, the correct answer is the monitor for the blood glucose level and the sign of the infection. So your answer is 100% correct. If you are giving the corticosteroid therapy for long-term management to the any kind of the disorders, you have to monitor for the blood glucose level and sign of the infections, because there is chance of the hyperkalemia. Because of the reduced immunity, there is chance of the infection also there. Okay, so hope this is very much clear to you people, right? So the next question is here, a very very important question. Don't know how many time I told you people related to chemotherapy side effect. Okay, so yes, a cancer patient receiving the chemotherapy who develops the thrombocytopenia where they have given the platelet is low. Okay, so which of the following complications should be a nurse monitor for? Okay, so here in the options they have given, yes, the not like bleeding gum, they are not given in the option like bleeding gum and petache. They have given monitor urine for blood and feces for occult blood. So this was the option given in your exams. Okay. So who all are chosen? The patient is thrombocytopenic, means the platelet will be, yes, the platelet will be low. The low platelet means increases the risk of the bleeding. Okay. So we have to monitor for the urine in the blood and feces, so which indicates the visible bleeding. Okay, that indicates that we have to stop the chemotherapy and switch on the another drugs which is like with less side effect. Okay, so there it is very very important, because the bleeding kills the patient. Okay, because the bleeding kills the patient. And in the options there were same options like increased fatigue and weakness, but we are giving the chemotherapy means it will suppress the bone marrow. Okay, the bone marrow suppressing means RBC increases, means the red blood cells decreases. Sorry, RBC decreases means the red blood cell decreases. Red blood cell is responsible for carrying the oxygen towards the peripheral tissue. Where the RBC decreasing means oxygen is not carrying. Oxygen is not carrying means the patient will feel fatigue and weak. Okay, so this is the very very important. And the next one is the like risk of the infection we have to assess. Okay, yes, the chemotherapy we are giving means it decreases the WBC also, which decreases the WBC also. If WBC is decreasing means we have to assess for the risk of the infection. Okay, so we have to assess for the risk of the infection, very very important. And the chemotherapy we are giving the platelet decreases means monitor for the bleeding. Chemotherapy we are giving the RBC decreases means increased risk of the weakness and fatigue. And where we have to give the rest between the every work, we have to give to this kind of the patient. And the WBC is decreasing means there is highest risk of the infection. In the exam they have asked for low platelet, and our answer goes to the monitor for the urine and feces for the occult blood. So this was our correct answer in the exam. Hope it is clear to everyone. Okay, so then the question directly from the non-nursing portion of the test series. Okay, so the national aquatic animal of India is the, yes, Ganga's river dolphin is the national aquatic animal of the India. So this is the very much important and very much correct answer here. Okay, so in the option blue whale was there, turtle was there, crocodile was there. So the answer is the Ganges river dolphin is the national aquatic animal of the India. So this was directly from the non-nursing portion of the test series. Okay, so then the next is the question like this. We are giving the magnesium sulfate to the patient of the eclampsia. Which of the following option which tells the a sign that indicates it reached the therapeutic effect? It reached the therapeutic effect. They have not asked the question related to the toxic effect. they have kept the question under the therapeutic effect only. Yes, if the deep renal reflex is absent means that is the earliest sign of the toxic effect. Still the deep renal reflex is +2 means it is started decreasing and it is at the peak of the, if it is at the peak of the therapeutic level. Okay, so we have reached the therapeutic level when the deep renal reflexes will be +2. So this clearly indicates it is a the therapeutic magnesium level is at the peak. Okay, so that is very very important. And in the options they have given the respiratory rate, okay, not above below they have nothing mentioned, just they have given the 12 breaths per minute. Okay, so that is the very very important. This is not our, what we can say, involvement of the therapeutic effect. Okay, yes, the respiratory rate decreases in the magnesium sulfate because of the CNS depression, but here it is not indicating we are reached the therapeutic, what we can say, we are reached the therapeutic effect. Okay, so the deep renal reflex is the best indicator that it will take. If the it goes into the toxicity, the earliest is the change in the deep renal reflex, or that's the absent in the deep renal reflex. Okay, if it is in the therapeutic peak range, the deep renal reflex is the +2. Okay, so the answer goes to the option A. That is the correct answer. Okay, so hope it is clear to you people. And here's the again the same question which is striked from our crash course related to the primary goal of the cricothyroidotomy, where they have given the scenario there. Okay, so the person of this age is came to the emergency room. Okay, where we are unable to access the supraglottic airway or the upper airway means, so in the emergency what we have to do, the next best step, that is the related to the cricothyroidotomy is your next answer. You people used to chase there. Okay, how clearly tell that it is used to provide the temporary quick airway in a patient with the upper airway obstruction. So that is the cricothyroidotomy with image based question of the cricothyroidotomy in the emergency, where we are inserting the needle just below the cricoid cartilage and above the thyroid cartilage. Okay, so here, so this is what we call as the emergency cricothyroidotomy. So we have clearly explained and the question struck in your exam. Okay, so here's the next very very important. Yes, in the crash course initial session, I have taught you the four very important things, that is the cross sectional study, case control study, cohort study, and experimental study. Among those, I have told definitely among these four questions, one question will definitely strikes in your exam. And the same scenario I have explained to people. Okay, where we are starting with the risk factor bacho, and we are following for the 10 to 15 years. Okay, and we are getting the diseases, yes or no, we are choosing like this. So the prospective study, the cohort study, I have same scenario explained in your exams. Okay, so that was came in your exam directly. Okay, a group of the smokers followed up for the 10 years. Okay, follow up for the next 10 years means prospective study we are doing means we are not going back. For the further 10 years we are assessing the risk. Okay, so here the answer goes to the cohort study. If the actual situation is similar like this only means the smokers were there, followed for the 10 years and associated for the lung cancer means we are starting with the risk factor here, and we are keeping them observing for the 10 years, and we are asking for like looking at for the diseases. So here also same explain, risk factor is the smoker, and the disease is the lung cancer. We are following for the 10 years, so that is what we call as the cohort study. So clearly I explained in the crash course session, and so this question strike all four situations scenario completely with clear explanation and flowchart, and how to remember that one I have explained. And many of you have commented in that video, sir, we have never seen the explanation of the research like this. Yes, so because I have make it in a such a easy like it is like drinking of the water easily. Okay, like that I have explained the all four epidemiological research designs here. Okay, so hope it is clear to you people, and who all are chosen the answer of the cohort study. So that is the directly very important and the correct answer. So these are the very important questions which were struck from the our crash course session. Okay, and this is just a part of the sample what we are showing to you people. Okay, and our aspirants who have sent me a screenshot of the thousands of the things. Okay, I am unable to see that one because I was somewhat busy, and just after exams I got an immediate like emergency call, so I used to attend that one, and that was the video is late. Okay, and one more thing, in YouTube many YouTubers are telling that this was the question, this was the question, this was the answer. Like some people are telling that the question came from the osteomyelitis, question came from the another things. No, the question whatever came, I know properly with clear options. Okay, this is the part one. In the part two, again I will come with the all the questions with the clear options and their rationale, because what I told you people is the, that is, two to three questions from the prelims will repeat for the mains. So it's very important to revise these 100 important questions and go for the mains. Directly indirectly this will help you people in the mains exam. Okay, so in the next portion I will come up with another very important questions, like a direct question again starts from the mini mental status examination, where 20 was the IQ. Okay, what was the so not IQ. 20 was the mini mental status score. Okay, what was the level of the cognitive changes? So that was the questions, like which was asked from the psychiatry also. I will come up with those also questions. Okay, so I hope it will be helpful for you all and entire crash course what you have discussed here. So the entire thing came in your exam. This was what a student, a teacher making some effort. Okay, which is helping the students means there nothing more than that actual teacher require. Okay, so hope it is clear to everyone. And as I told, we have launched the very important mission means now test series. Okay, so for our upcoming NORCET mains exam, and I have said all the best to everyone, master nursing classes students. Okay, so if everyone, any one of you wants means, you can go for this NORCET mission means. Okay, so for this one, as I told, what people have to do is that to download the Master Nursing Classes app. I have given it in the description box. And very importantly, like if you want to be a part of our WhatsApp group, okay, where we will be sharing the important morning dose and night note for our upcoming mains exam, and special important points for the RRB exams. Okay, so that is in the free of cost. If you want to become a part of our what we can say WhatsApp group and Telegram group, the link is given in the description box. You can join from there. So we'll meet in the part 2 video of the very clear explanation. Tab tak ke liye, Jai Hind, Jai Bharat. Take care.